We have a chairman here, Dr. Pratap C. Reddy, and MD, Ms. Neeta Reddy, who joined us for the evening. Members of the media, a very warm welcome to you. And more importantly, we want to thank some of the recipients, the patients who benefited from our transplants, who joined us here. Thank you to one and all. Thank you for also allowing us to celebrate this day and celebrate the fact that you have many years of life. So without much ado, I'd like to invite Dr. Arnab Thakur, who is the Program Director and Senior Consultant for Liver Transplant Program.
Respected Chairman, MD, Dr. Rama, CEO, my senior colleagues, and my dear patients. Today is the World Organ Donor Day, and for all of us, it's a very important day because we live our lives with transplants, and organ donors are the ones who make it all happen. But for these organ donors, a lot of lives would be lost, and it would be a different world altogether. Our chairman has been a pioneer in promoting cadaver liver transplantation, cadaver organ transplantation in this country. And his role has been exemplary, not just for Apollo Hospitals as a group, but even for our country as a whole. So that is one of the reasons why we do this activity here in a much larger volume and with a much larger success than anywhere else in the country. So I'll just briefly take you through the transplant program that we have at Apollo Hospitals. And I'll be speaking on behalf of all the liver, kidney, and heart and lung transplant programs. And I just try to brief you as to the activity that has been happening. So transplantation, organ transplantation is a team approach. It is no one person holds the secret to its success. And it is only with a synchronized, coordinated, multidisciplinary approach that all these high energy and high resource endeavoring programs can be brought to any significant success. The transplant surgeons, the cardiologists for the heart transplant, the hepatologists for liver transplants, and nephrologists for kidney transplants play a key role. So as the intensivists, the anesthesiologists, the radiologists, the pathologists, the infectious disease specialists, the psychologists, the dentists, pulmonologists, and a host of other therapists, as well as facilities like blood bank, transplant coordination, and all these services are key components to a successful transplant program in any institution. So, what is the need for organ transplantation in our country? And for various organs, this is slightly different. But in summary, there is a humongous need for organ transplantation in the country. By the word humongous, what I mean is that about 10% of India's population suffers from chronic liver disease, secondary to hepatitis B, hepatitis C, or alcoholism. And from this 10% of the total population of India, about 20%, that is about 2% of the population, has a lifelong risk of becoming a cirrhotic or developing a liver cancer that might need a liver transplant. So you're talking about something like 2% of the population of India over a lifetime prevalence, which if you divide by 10 is what you get, more than 2 lakh patients per year who would need liver transplant. Against that, what we have is about typically 150 to 200 donors across the country every year. The gap between the availability and the need is not fathomable. It is like an abysmal precipice which has no bottom visible. Similarly, there is diabetes and hypertension are widely prevalent in our country, and about 100 million population, 100 per million population suffers from chronic kidney disease secondary to one of these ailments. Not all patients in our country, unfortunately, even make it to the hospital when they reach end-stage renal disease. Similarly, by talking to Dr. Ramesh, I came to know that about between 1 to 2 million patients in India today suffer from heart failure and potentially could end up requiring heart transplant during their lifetimes. But just like I just said, the current donation rate across the country is estimated to be somewhere less than 0.1%, 0.01%. And if you take Tamil Nadu in particular, we are significantly better at 1.15 per million per year. But as compared to the rest of the world, if you see, Spain has a donation rate of about 35 per million per year. And even the lowest in a relatively more developed societies, while Mexico is very similar to India, but even they have a donation rate of about 3 per million per year. As compared to that, even Tamil Nadu, the most ideal place in India, still has a very poor organ donation rate, and I think this is the reason why we all have to get together, put our minds together, and see where is it that we are lacking in our efforts, in spite of the efforts of the likes of Dr. Reddy, who have devoted so much of their energy, their time, and their pioneering efforts in this direction. So this is the situation in the clinics. While there has been a very small and modest rise in the number of transplants that are being done year after year, there is an escalating and exponential rise in the number of patients who are on the waiting list, and consequently high mortality on the waiting list. To give you an overall scene in our hospital, that is the Apollo Hospitals as a group, we have done about more than 500 cadaveric organ donations, and the total number of kidney transplants done by the Apollo Hospitals is more than 5,000. The number of liver transplants is more than 1,300. We have done 16 heart transplants and 8 lung transplants in our hospitals. And the rough split between cadaveric versus living donor is about 25:75, which still, it might still look like we do more living donors than cadaveric donors in our hospitals. But even this 25% is a record high as compared to any other hospital group in our country. And this is in spite of these numbers, and in spite of the spread of these transplant programs across the country from Delhi to Chennai, including Hyderabad, Bangalore, Ahmedabad, and Calcutta. In spite of the diverse areas, the challenges, there has been a consistent and continuous survival of more than 90%, which is significantly higher than the average standards of care even in the Western world. So just to give you a brief highlight about our kidney transplant program, it was among the earliest transplant programs we developed in our hospital, and it is also among the earliest programs in the country. We have done some very astounding numbers, which is like more than 5,000, and also that ranks among the highest in the country so far. We have a complete kidney care program and an end-stage renal replacement program, which includes hemodialysis, peritoneal dialysis, continuous ambulatory peritoneal dialysis, and all that would entail in the end-stage renal disease programs. Next. Similarly, liver transplant, our chairman has been very passionate, and he has supported liver transplant from the very end, even in those days when liver transplant was not considered to be worthwhile or successful. He has been backing up the efforts, and consequent to those, we had the first liver transplant in our country performed in Apollo hospitals. The first program to be developed into significant numbers and in keeping with the standards of care was developed under his mentorship in Delhi. The highest number of liver transplants to be performed by any hospital groups is from Apollo Hospital. It is also the most widely available network for liver care in our country. Talk about cadaveric organ donation and cadaveric liver transplantation. Apollo Chennai stands at the first position in our country. We do more cadaveric liver transplants than any other program in the country, and this is all in keeping with the success rates, which are better than what is achieved in the best centers in the world. For example, the UNOS survival rate is about between 83 to 88% for liver transplant, while in all our liver transplant programs, including Chennai, we consistently maintain a survival rate of more than 90% for any given period of time. And we also have an impeccable record for living donations. We have not had a single accident of any sort in any of our living donors so far. Next. Similarly, heart transplant, the first heart transplant from a cadaveric multi-organ donation was undertaken in our hospital in 1995. And we also have the longest surviving heart transplant recipient in our country, Mr. Gupta, who has lived for 14 years. Several patients have been served in our hospital, including some patients from the US as well. Our program here undertakes combined heart and lung transplants as well as isolated lung transplants as well. It is also backed by a huge coronary artery disease program with huge surgeons surgeons that rank among the best in the world, and there the eldest patient who received a heart transplant, who was 65 years at the time of transplant, is 68 now. And the eldest female patient was 63 at the age of transplant and is now 65, received the heart transplants at our hospital in Apollo, Chennai. Talking about cadaver organ donation in our country, like I just said, Dr. Reddy has been a pioneer, and it is because of him that we have the act that we have today. A lot can be said about his contributions in the field of cadaver organ donation and transplant. We will hear about it from himself when we hear him during later in the day today. The highest number of cadaver organ donations by any single institution has been undertaken by our hospital, and we account for more than 50% of all cadaver organ transplants, including livers, kidneys, and hearts, as compared to any other organization in the country. We are also the pioneers in approaching it in a very organized manner. There are stray donations happening here and there where there is no control over the physiology of the donor. Consequently, the quality of the organs retrieved, and therefore the outcomes in the transplant performed are very unpredictable. And consequently, we will hear from a lot of patients who come from the north that they have a significant doubt whether a cadaveric liver transplant would be just as good as a living donor liver transplant. And the reason behind this is that the stray transplants that happen there are from organ donors that have not been optimized for the physiology. They have not been given the physiological optimization required to improve the quality of the organs being made available from them. So we are actually a full in-house organ procurement organization where we care for each and every step of the organ donation and transplantation step, starting from the early identification to hemodynamic stabilization, declaration, and the necessary caveats required for a good quality organ retrieval system. There are several landmarks that we would be very proud to talk about, and one of them is that we have done the transplant of the smallest kid by size, who was a 5.5 kilograms baby, about 3 years now. He's now 3.5 years old and living a very, very happy, normal life. He's the smallest kid in India to receive a liver transplant. We have also done living donor liver transplants for kids that have been flown in on ventilators without recordable pulses and blood pressures. We have done the first open heart surgery along with the living donor liver transplant in our hospital here. There are several heartwarming stories that sort of brings emotions to our eyes about a family, for instance, from Salem who had come here for treatment of a neurotrauma of their son, and unfortunately he couldn't be saved. But they came forward to donate, and when they were asked to sign the consent, they chose to put their thumb impressions. I mean, they didn't even know how to sign their name, but they had the largeness of their hearts to donate the organs of their only son, in spite of the challenges and the grief that they were going through. Similarly, we were very fortunate to have the organs of a 12-year-old kid from Waardenburg syndrome, who had Waardenburg syndrome and consequent deafness. And he suffered brain death as a consequence of repeated treatment with cochlear implants. And in spite of whatever the family had gone through, they decided to go ahead and donate the organs who were transplanted in all three recipients' heart, liver, and kidneys. And we could give it to a 9-year-old girl, successfully living now after 2.5 years of this transplant. Similarly, the landmark donor, which basically made organ donation popular across the state as well, the famous boy whose name was Hitendran, and the family of 2 doctors who donated the organs also was undertaken at our hospital in Apollo Speciality. Next. So what makes us special is that we have it is not something that we do half-heartedly. We have the entire team of specialists, sub-specialists, and all the supportive departments required for each organ for transplantation. So we have like a comprehensive disease management programs, and in that we not only cater to the A to Z of the disease spectrum, but at every point from the A to Z, we provide a 360 degrees care which not only addresses the organ-specific disease, but also the supportive care, including nutrition, physiotherapy, and all the other supportive services needed for that. we also have the state-of-the-art infrastructure, and this is where Dr. Reddy has always excelled as compared to anybody else that I've ever known. He believes in providing the latest and the best equipment needed to support the endeavors by us. And we have all these gadgetry, but needless to go into the details, but it would suffice to say that nothing more can be expected or availed anywhere else in the world as well. So this is the highest and the best that can be made available to the doctors to support their endeavors when they try to do these high resource engineering procedures. We also have a complete, we have a bottomless blood bank, if I should say, with component therapies, leukodepletion and irradiation available for all the units. We do net testing so that even the patients with hepatitis C and HIV who are in the window period could be picked up, and we can prevent these infections from being passed on to the recipients. We have a state-of-the-art molecular biology lab, a complete transplant immunology lab. We have transplant virology and infectious disease facilities, and we also have dedicated transplant pathology. We are present across the country. Our patients, irrespective of where they come from and get transplanted in whichever of the units, can go back home and be sure that there is going to be an Apollo close to them for follow-up and for taking care of their organ transplants as well as their overall health after they go back home. We have comprehensive, like I said, disease management programs and clinics as a public interface of these programs, and we take care of all the aspects of the patient's well-being, not just the liver, the heart, or the kidneys. So thanks. So the message for today is that organ donation saves life. Donating organs is a gift of life, and we all should know that there is there is no need to carry our organs to heaven. Heaven knows that we need them here. And the question that all of us have to ask ourselves is that after we die, where would we like ourselves to be, in the dustbin or within this beautiful kit?
Thank you, Dr. Thakur. There were many eye-opening facts in the presentation. May I please invite Dr. Paul Ramesh from the Heart and Lung Transplant team. We'd like to hear some stories from the heart.
Thank you very much. I've decided not to have any PowerPoint presentations because I want to speak from the heart today. Being a transplant surgeon is one of the most rewarding experiences, and I think predominantly, I'm going to make only 3 very short points. One is the fact that you come across people like the donors' families. And let me tell you, in India, it's not a very straightforward deal. The parents or the spouse may be very happy to give a donation, and then you find an uncle or an aunt or someone else who comes in suddenly at the last minute and says, no, what do you think you're doing? Just stop it. This is not really a right thing, and is this what you want to do? They mutilate his body, they disfigure his face. And yet, time and time again, I have seen the spouse or the parents stand steadfast and say, and this is at the darkest hour of their lives, their loved one's gone forever, and yet they have not just the kind of magnanimity to offer their child or their spouse's organs, but to stand steadfast against the family and say, this is what we're going to do. And I think it's such a great uplifting moment, and those kind of moments are few and far between in life. So I feel quite privileged to be a part of that. And I think I want to thank the media for actually emphasizing on these stories. You can't emphasize this too much. Sometimes some of my colleagues say, not another transplant story, not another donor story. But I think you can't really emphasize this enough. And just as an example, I've asked at short notice one of our transplant recipients, just on 2 years ago, Dinesh, if you could just stand up. He's an exceptional story, and he was a young chap who was very, very sick. He could not write his exams, he could not even walk to the toilet. And the gift of life has had him now completing his CA, and he's doing exceptionally well. You can hear more of the story from him. And this is the kind of result you get from the effort that's put on by the media, by the donor families. And also I want to mention at this point the transplant coordinators, both the government ones who sometimes if you tell them there's a sick patient lying in your hospital, they call you up at 2 in the morning, telling you there's a potential donor, they still get to consent, but it's possible, just make sure you're around and things like that. And of course Nivedita and Anita in our hospital, who kind of wait sometimes up to 10, 14 hours just resuscitating these donors. And because the resuscitation of these donors is so important, it's actually the organs that are going to 5 or 7 other patients. And so that's another very important aspect which I think we've discussed before, and it's something that we as a group in Apollo are able to do very well within our hospital, resuscitating donors. It's a fairly complex process, especially where the heart and lungs are concerned. Because if you take the average donor, he has a 85% chance that he can donate his kidneys. He has a 70% chance that he can use his livers. Only a 28%, less than 1/3 chance that he can use his heart, and less than a 17% chance that he can use his lungs. Because when your brain dies, the lung is quite fragile, and the impact on the lungs is quite high and quite quick. So therefore, in order to improve both the working of these organs after the transplant, we've got to work very hard. We are also now trying to kind of make this donor resuscitation program a little bit more widespread, taking it to GH as well, and I think in the coming years we'll surely succeed with that. Thank you.
That is indeed inspiring, and what better way to rededicate ourselves to this cause than to actually hear from some of our recipients their incredible stories and journey back into normal life. We have a few who have come here today. Thank you so much for coming. May I please call Dr. Radhakrishnan, who is a plastic surgeon, to come and share our story with us.
Dear Dr. Reddy, all my colleagues, my surgeons, first of all I thank organizers for remembering me and calling me for this occasion. I am now 69 years past, 70 beginning, but my original life is only 3.5 years. You know, I am a non-alcoholic vegetarian. The diagnosis has happened to be a cryptogenic cirrhosis. You would have asked why, being a doctor, you are not aware of what's happening in your body. Honestly, I tell you, I didn't check my liver function test. Unnecessarily, why should I check? I was going on checking about my blood sugar and other conditions because I was a chronic alcoholic, diabetic. One fine morning when I was going for a rounds, I had a bout of hematemesis. Suddenly, luckily I was in the hospital, so they treated me, they brought me here, my physicians and everyone, they did all the job to arrest the bleeding. The next day morning they shifted to my ward. Unfortunately, I had another bout which is very severe. I became unconscious. They treated me in a ventilator and continuously following up. The stage has come. My liver is not able to do anything. Meanwhile, I had 2 episodes of encephalopathy. Then they decided to go for it. I was very much apprehensive because being a diabetic, 65 years old, what is the use? Enough I have lived. And it so happened, they called me on March 22nd. I just held and healthy. I went. Unfortunately, I developed a temperature 1 or 2. They refused. I came back home. Then again, April 8th, they called me. I prepared. They took me to the theatre. I was prepared happily. Then again, unfortunately, the liver donor is not a good liver. They said cancer. I said to my family members, so God himself says no. Why should I undergo surgery? I tell you one thing, this is small. When we were all kids, we used to say angel, even for 2, 3 other things. Like that, the angel came to my daughter. Only one daughter. She said, Appa, I know you are going to die after the surgery. But why can't you take 1% risk? The dean says, we are only my wife and my daughter, my son. Then I said, go ahead. Boldly I came, thanks to all the people. God has sent these people to do surgery on me. I became all right. In the 5th day, they sent me home. Now I am doing all the jobs what I was doing earlier. I was a retired superintendent of government hospital. I was a plastic surgeon. Even now I am doing a plastic surgery. I am doing all that. I am working in an insurance company for 5 hours. So my request for all this, I am actually telling all the patients, everyone used to say, don't drink alcohol, don't drink alcohol. It is not so. I am not very well dedicated. Please have a periodic checkup. What I have not done. That's one. Number 2, getting surgery, after surgery, you can lead a normal life. The only thing with a little immunosuppressant drugs, that also they are going to reduce periodic checkup. I am doing all the normal routine work. Thanks for allowing me to talk here. Thank you very much.
Can we have cute little Bhavya? over here.
Hello.
He's just 3 weeks from his transplant. 3 weeks ago, and this is his father who gave half of his liver to him. तनिक question बेटा?
नहीं.
तनिक क्यों हुआ था क्यों? क्यों था? क्यों हुआ?
આજે ને કેવું છે બેટા તમે ક્યાં રહ્યો છો શું છે હા બાબુ રાખો કેવું છે કેવી રીતના હા
He said he has 3 sisters and he's read the name of these 3. And on the 5th day of his surgery, when I went to see him, he says, "Now you have to relieve me. I have to go home and I have to help my sisters. They are alone there without me." He's from Gujarat.
એની પેલા
Billy Fela Andaud.
પછી
Lucknow.
લખનઉ અને અહીંયા કેવું થયું અહીંયા
I am liver
liver transplant અત્યારે તમારા liver transplant નું high class થઈ ગયું
Ha.
તબિયત બહુ જ સારી
Ha.
હે
Ha.
Yeah, he visited our class.
Thank you. Shukriya.
CMC graduate, native of Chittoor, and I was working in CMC after, because of the reason I worked in Chennai. After that I went abroad. From there I got sick. With the sick I came to Apollo. Apollo OPD I was doing moisture checkup. When they were doing ultrasound, they given me water to check bladder and all. While they were pushing with the monitor and I had arrest, almost I gone. Dr. Subbarao is the one got me back again and to live as a normal. Now I am working in dialysis, Sundar Medical, with all the miseries I am going through. Each and every moment Dr. Subbarao is helping how to manage my medications and how to make how to work in the situation also. And also I am greatly thankful to Apollo because now I am standing with my legs and working in infectious areas. Because of Apollo, they have given me a lot of privilege to stand over and to work in dialysis. Now I am working in dialysis. I am so proud to tell about Dr. Subbarao as well, Apollo, to give me such an opportunity to live back and to work for the patients itself on dialysis. And also I would like to insist about the awareness of the organ donation. The Apollo motto is touching life, but organ donation is giving life, making life. So please donate the organ. Thank you.
Thank you so much, Mr. Edwin, for extending your services. A marathon actually, right? Share your story with us.
Good afternoon, everybody. I am Dinesh and I am pursuing CA. I am standing before you. It's because of Rahul's parents who are brave to donate their son's heart to me. And I was suffering from cardiomyopathy and was not able to even walk within my house. I am thankful to Dr. Mother, Dr. Sundar, Dr. Pal, who made my life here. Dr. Vijay Kumar in Tripura referred me to Apollo Hospital that heart transplant here is good, and I am here, and I would like to thank brothers, sisters here who took care of me very well. And I also to thank Rahul's parents once again because they made me to live here. Thank you.
To address, we have Dr. Amalur Pavanathan, staff. So we'd like you to please receive it from our chairman.
Role model hospital in cadaver transplantation. First, let me record it on behalf of the company. No other private hospital has gone to such an extent to identify cadavers, get them certified, get the organs harvested, and get the organs distributed in a very fair and equitable manner and such a transparent way. Apollo is one model corporate hospital which I wish every corporate hospital would follow in India. No other corporate hospital has done like what has Apollo done to Tamil Nadu. More organs from Apollo has gone outside than Apollo has received. So Tamil Nadu cadaver transplant program has benefited immensely from Apollo's years, Apollo's efforts, Apollo's time, and Apollo's industry. And I thank everyone in Apollo who has made this happen. This is the moment I must thank my guru, Dr. M.K. Mani. Because of him, I entered into this field. I got interested. Even today, I don't talk to him often at all. In fact, I don't look up to him at all. But not a day passes without my thinking about him and without my paying silent namaskars to him. He is one role model doctor for all of us when we were young. And Apollo Nephrology Department and Apollo Liver Transplant Department are one of the pioneers in the country doing outstanding work. And now these two departments are highly competed by the heart transplant and lung transplant department. Those young doctors, heart and lung surgeons, are doing tremendous work. And in a few days, I would like to hear a very glad news about a double lung transplant. And when I needed some computer, Satyabhama is like my elder sister. So I just rang up and said, Madam, I require some computers. Within one day, she called me back and said, whatever you want, you will have it from Apollo. Apollo is glad to give you. Thank you very much, madam. And thank you, sir. Thank you, Dr. Reddy, sir. You have been very kind to us. You have been very kind to Tamil Nadu government. Thank you very much.
Sir, 1 second. Sir. Sir, location, sir?
Thank you.
Sir, sir.
And words. May I call upon Dr. Anand Kakkar? Work has gone into bringing the transplant program into India, and that was done by our chairman. I'd like you to please talk about that and then call her on stage.
So, we all know that Dr. Reddy has been the pioneer for healthcare, the modern day healthcare in our country, and there is something special about organ transplantation and cadaver organ donation that is very close to his heart. And I would just like to bring it to the notice of all of you about his unique and pioneering role in getting the Transplantation of Human Organs Act passed in 1994. And long before that, he has always been passionate for cadaveric organ donation and transplantation in our country. And he was a part of the draft resolution, and it was actually his efforts to get it initiated. He was a part of the draft resolution, and for the longest time he had been lobbying to get it passed. But the final act of getting the Transplantation of Human Organs Act passed in 1994 was by his efforts at the time of the Narasimha Rao government, when Mr. Narasimha Rao was the Prime Minister. And he coordinated with Mr. V.C. Shukla, who was the then Parliamentary Affairs Minister, and it was during one of those winter sessions that the Parliament had gathered to impeach Mr. Session. But the House didn't have the majority, the government didn't have the majority to impeach him, and he very ardently aspiring to get this work done, approached the Minister of Parliamentary Affairs and requested him to do this noble act, while the other business that was planned were not going to happen anyway. And so he and Mr. Shukla met the Prime Minister, and it was then that the Cabinet approved it, and subsequently the Parliament also enacted the THO, and that is the reason why we all have cadaveric organ donations in this country today. So I just wanted to bring it to the notice of all of you that it was largely and most of his efforts that have brought about the Transplantation of Human Organs Act in our country today. So with a huge gratitude towards his pioneering efforts, we invite him to say a few words.
Namaste. I share the joy of the parents and join all of you in wishing the recipients long, useful life, as our Dr. Radhakrishnan said. I think it's a very momentous day for all of us. in Tamil Nadu. At the beginning itself, I want to say, thank you, media. We wouldn't be talking about these numbers. We wouldn't be talking about saying India is capable of rising to the standards that have been established across US and Europe in the organ transplant program. But way back, let me go back as what Anand Kakar said. After a decade of Apollo started, our ambition was to bring the best healthcare that's available for people anywhere in the world, the quality and the cost benefit. In early 90s, in a single month I heard that there were 4 or 5 deaths in what's called the end-stage disease. And at that time it was most commonly renal, and they couldn't get a kidney, and unfortunately they lost him. And of course the number of cases from other organs, heart failures were tremendous. So that's when I thought, why should we do something about it? If you could bring all of these, if our doctors and our healthcare system to do what is happening anywhere in the world, why shouldn't we have this major division of giving back life for people who had no other hope? So I think this, I thought of the pioneer, Dr. Starzl in Pittsburgh. I went to him and he told me, Dr. Reddy, I'll be very happy to promote this program, whatever I can do in assisting your team to come and do the study and take it, I will be very happy. Then he mentioned saying, do you guys have an Organ Transplant Act in your country? We didn't have. So that's how I said, as Anand said, I went then to Minneapolis Heart Institute, brought 20 kilos of all these documents that they were using, and our legal teams and everything worked on it. Then we went to Delhi, worked with the Ministry of Health, Ministry of this one, got the act ready. But the dramatic thing happened is when I went to meet Mrs. Zuckerman for something else, because he wanted a hospital in Raipur. He told me that today we called for a session to impeach session, but unfortunately we don't have the majority. I said, then why don't you get this done? Then surely he said, let's go to the Prime Minister. So the moment I went to Prime Minister, he said, I promised Dr. Reddy that we will pass this act. So take this up. So I think almost in a couple of hours, the cabinet met, and then that afternoon, when the session began, the only resolution they passed is not an August session. The only resolution that they passed is to give life for so many people who deserve to wait. I have these huge numbers here of number of people who are waiting for kidney and can't get a kidney. The people who are waiting for liver is astounding numbers. Some 50,000 require heart transplant, 50,000 require liver transplant, 175,000 require renal transplants. These numbers look frightening. Of course, the eye is 4.6 million people who have corneal blindness and can lead normal life if you can really get the transplant. Is this possible? Now, when we have done 100, 200, why are we talking about saying we are here now to see what can we do to alter the scenario for the end-stage disease by bringing the Cadbury program popular? Popular, what I mean popular is to see that when a person dies, instead of burning the body and getting the ashes, as you saw the beautiful side by Anand Kakar, what is needed is for them to think, saying, is there something else that we can do? Something, like I still recollect the first transplant that we had was a person who sat at the dining table and something was missing on the dining table. Even before his wife said anything, he got the motorbike and near Satisfied. He came out of the main road and had a head-on collision. They brought him here. The first multi-organ transplant was on Christmas Eve. When I asked the parents and then said that this child will live in several people's lives, they didn't, I can fully understand. They never even thought, what is this guy talking about? We came to this hospital to see my son literally, now he's asking for his organs. So there was some amount of, not disgust. But 1 hour later, the wife came with her mother and then said, what do you mean by that he will live in several lives? I said, if you give his heart to somebody who needs the heart, he will lead a normal life. Maybe, as you see the young man, if he gets life for another 60 years, what it could be. And kidneys, liver, and all of these. So, she didn't say anything, she was heartbroken. But went back and called me 45 minutes later saying, this wonderful doctor who was transplant coordinator in ICU, he said, Dr. Reddy, I would like to see you. And went there, he said, if what you say is true, we would like for you to go ahead and do the first transplant. That is the first one on Christmas Eve when we did the multi-organ transplant. The cadaver transplant program, and if that had been done when no other hope is there for life, this could be done to help several individuals to make a difference. So I think the whole program, and I'm happy that Dr. Abdul Kalan is here, is beautifully coordinated. What we kept is saying, we are with you, because our purpose is common. We want to do a program as successful or better than anywhere in the world, so that we can make a big difference for a large number of people. Thanks to, I think in 3 years, they have made a very significant impact, and Tamil Nadu should feel proud. Should feel proud that what the media has done Tamil Nadu as a leader in the cadaver organ transplant, but we have a long way to go. Tamil Nadu is in a part of the country, so we want this to become the national program, and I also must thank Sheila Priya here. The act was passed in Delhi, but it was an act that was passed, but didn't have enough support for doctors to declare them brain dead. So this is what I think Sheila Priya and the other colleagues in the government passed that ordinance, so that doctors could, when they are satisfied, after doing an EEG, brain dead, 6 hours later they repeat it, and again if it's a flat curve, then they are allowed to declare that he's a brain dead patient. In heart it's very simple. The moment you see a flat line, everybody accepts. But in this case, we don't allow them to go to a flat line. As Anand said, we want a live organ. That means the heart must be pumping, the lungs must be giving a sufficient oxygen. So the heart lung, the ventilator is on, we are supporting the heart, and then if parents give that permission, which I think were very successful recently. I think about 5 weeks ago, I came to the hospital. Suddenly they told me, sir, the liver team is so busy, organ transplant team is so busy because they did 2 cadavers and a live child in 24 hours and 5 renal transplants. What a program. Nowhere in the world could you have heard saying in 24 hours they did 3 livers and 5 kidneys. And 2 of those, and 3 of those kidneys and 2 of those livers are from a cadaver. So I think this is a phenomenal thing. We have the will, and the people are understanding, as you said, that individual who didn't know even to sign, you could put that, because already media has prepared it, saying if it ever happens, that time. This is where we had people who take a pledge. All of Apollo family members have taken that pledge, saying when it comes to us, we are free for the doctors to take whatever organs that are required. Now we are just talking about only the heart, lung, liver, kidney. Maybe very soon we'll talk about pancreas too. But more importantly, just now we started in Hyderabad, the tissue bank. So we'll have many things. We'll have the ligaments, we'll have the skin, we'll have so many other organs which we can keep and use it for the right people at the right time. So I think it's a very significant difference that this cadaver transplant program is one. And being in a hospital, we have seen many, many wonders. You call it miracles, whatever, but I call it saying honest, good work, teamwork of Apollo. And it's not just Apollo today. The country is proud that many, many hospitals are able to do equally excellent work in the fields that they have chosen to work. But this is the most difficult part of it, is the transplant program. I'm happy with the great effort that they put in. They became the greatest and solid organ transplant in the world. Even when I went to Mayo Clinic, they said, Dr. Reddy, you overtaken us. So I think this is something which is a pride. The other day when we heard some of our doctor investors from, well-wishers from US, so they told me that, Dr. Reddy, you turned the leaf, needle 360 degrees. People used to come to US for a heart surgery, but a patient came from America to here for a heart transplant. I think these are the things which we would like to live and then say, hey, here in India we can do this. Because this is the confidence I had. This is not the confidence in me. I had the confidence in the team. You know, whether it is a ward boy, whether it is a technologist, whether it is a nurse, you know, the whole lot of the super doctors, they all learned saying that we can do well, but we can do super if we work as a team. I think that is the strength of power. And this is where I think it is needed. I'm sure, you know, with the help that media can give, we'll take this to a tremendous level because it's needed. It's because why should they? If there is a way to live, why should we die? If there is a way to give them, you know, life, we should all fight for it. And it's not a single person program. I think it's you know, everybody is involved in this. As I said, there is Team Apollo here. I don't know, 300 people in the Stanford program who are working towards this goal. Similarly, I think if everybody gets on, we can honestly say that we have, and what we need is an all India data registry, which should happen. Then probably get on to the global registry. You know, why not? Like the patient came from there, and we had a liver patient who came from Japan. I still recollect him. And they said, no, this liver is not useful for any of our recipients here. It's not so good. But that patient preferred saying, even if it's not so good, let me try. Unfortunately, it's absolutely well. So I think these are the things you call it a miracle. I call it saying is honest to goodness service. And in this, you know, everything else, you allow him to live well. In this, I think you are doing back life to that individual. As Dr. clearly said, he's got back to his profession. You know, I think it's a very wonderful program that we're doing, and we need everybody's good wishes. And more importantly, I think I'm glad, you know, the other states, if you push them, we now got it done in Karnataka with the act is passed in Andhra. I think Delhi is almost ready, I'm sure. You know, a few days ago I missed the board meeting. Otherwise, Chief Secretary would have told me that in the last class that they'll do it in Delhi. And I think all the other states pick it up. India could have a very, very solid program. And then we could try to send these organs. You know, we have a number of times. The other day when I was in Hyderabad, they told me they picked up the liver from Vizag and did the operation in Hyderabad hospital. You know, this is all possible, ours together. I know a dentist in Delhi, in Mumbai. The organ was from here. So when they told him, he flew to Delhi that night, and the organ went from here to Delhi, and they did the liver transplant. And the person is absolutely fine. So I think these are all things medically. The team have proved that they can do what others can do anywhere in the world, and I'm sure they'll do better. Because as Anand said very quietly, he didn't emphasize that because he didn't want to take that pride, that our results are better than the best centers anywhere in the world. You know, similarly in our heart surgeries, we are 99% plus. Similarly in this, 1 year survival is more than 99%, both in adults and children, compared to the West, where it is 85 to 87%. So I think this is a thing we should be proud we have the skills, and we are pleased that we could bring the team together. You know, one couldn't have done it, as I said, all that. So I think it's a very wonderful program. This is something we should be proud of and say, let's take this to the next level. And the next level is to see how can we make it a pan-India program. How could we see that the bodies that are not lost? I feel so sorry about this thing. Number of people who are dying on the highways. We gave a program. We gave a program to the Ministry of Health and Ministry of Highways, saying, here is a beautiful proposal. So all that we need is when if you are collecting, say, 40 rupees for somebody using the highways, you collect another 4 rupees, put it in a kitty with an insurance company, they will completely fund the total ambulance services, including air ambulance when required, and the trauma services across. And recognize, like certify the centers which can receive this, whether it's a government, private, or charitable institution. It's a beautiful program. Unfortunately, you know, I could convince each of those ministries, but I couldn't bring them all together. Pita is here. She attended 2-3 coordination meetings, but still is pending. So I hope things like this, they should think, hey, here is an opportunity for India to do this. Instead of saying, why should, Dr. Reddy or Apollo team come and repeatedly ask us? It looks as though it's a favor for them. It's not favor, it's favor to the country. And where you are in that seat, if you do this, it will make a very big difference. This is what I've told several bureaucrats. Like, somebody all power, how well he is doing, how well he is taking this program forward. So now therefore, Hyderabad is following exactly the program that they have started in Chennai. So, God bless all of them. Thank you all.
Besides the people who shared their experience with us, we have many other special people who have benefited from the transplant program here, who are here to share this day with us, and we'd like to take a picture and create a memory of this event. We'd like to please invite the patients who have come here, taken all the trouble to be with us today. Delhi, right? Mr. Vinod Agarwal from Delhi. He's recently benefited from our liver transplant program. Could you like to speak to us, sir, about your story?
Ladies and gentlemen, namaskar. I'm such a lucky person that I've been operated over here. On last 9th of July, I got a call from this place, and we booked the flight and we missed the flight. And the second flight also we were going to miss just because of heavy rain. But fortunately we got the flight. And within 24 hours, I was being operated. Thank you very much.